Dr. Perry, welcome. Thank you for coming before the committee. Would you like to make an opening statement? And please introduce yourself, and would you like to make an opening statement? Thank you.
Leanne Perry, Executive of the Queensland Catholic Education Commission. I was glad to follow Fleur. This is also my first appearance before a committee, and I'm 6 weeks into this job. So just preface that. And certainly my first time speaking around issues to do with early childhood care, having come from a different background. I thank the committee for the opportunity to provide a submission and to appear today. I'm appearing today representing the 24 kindergarten services offered by our 5 delegated authorities. So in that context, because as you may be aware, the Commission has responsibility for schools and so on, but I'm here representing the interests of those who provide our kindergarten services across the state. As our submission indicated, we strongly support vaccination as an important public health measure, and therefore we strongly support this bill and the amendments proposed to the bill. It would be our view that vaccination is a critically important public health measure. It's supported by a very strong peer-based, peer-reviewed evidence base, and it is something that we support. We support the bill in that it provides discretionary power to childcare providers and early and kindergartens in terms of flexibility within their enrolment practices. So while it is the case that we would anticipate that our Catholic providers will require up-to-date vaccinations, we respect the right for people to have that discretion around making that choice of enrolment. So we also are very mindful of vulnerable children, and our providers currently and would continue to provide work very closely with parents if they present with their child not vaccinated or not up to date. Our current practice is that our providers don't just say, well, you're not vaccinated and go away. In fact, they work very closely. They help put the parents in touch with the relevant agencies and work them through and support that process to assist them if that's the choice that they wish to make in terms of vaccination. So, as always, our providers take a very strong pastoral approach and work very closely with the providers. And we would obviously expect that would continue to be the case. So we support the amendments, we support the discretionary power, but we would also anticipate that our providers will require children being enrolled to be up to date with their vaccinations unless they have the exemptions as provided for here. We would also strongly support that there be a very good communication process around this so that parents are very aware of what the changes are. And we are also very supportive of the fact that, as we understand it, the bill will mean that people can't be seen as being discriminatory if they choose not to enrol children who are not fully vaccinated. So we think that's a very important position to be in, and particularly for staff to protect them from being accused of being discriminatory if that's the decision that the centre makes to do that. And we would certainly also be looking to that there be good resources provided around communicating it, and which our providers would support as well. Thank you.
Thank you very much for your opening statement. Dr. Perry, you mentioned a vulnerable child. Can you just define, for the purpose of the committee, what constitutes a vulnerable child?
As has been provided in the information we were given, so those who might come from an ESL, a non-English speaking background, some from remote Indigenous communities, those others who might not have engaged well in terms of having the requisite information, either because of their educational background or their social circumstances. So those who may not have vaccinated their children through lack of information, lack of education, or through some other personal circumstance. So in other words, if someone presents, we don't just take the view, well, you haven't done this, so therefore we're not even going to consider you. Our response is to engage with the parent, to talk to them about it, and if they indicate that they wish to get their child vaccinated, to actually assist them to access the appropriate providers to do that.
And do you have a sense, or has there been discussions already about how you would consistently apply the assessment of what children might fall within that group, that you would still let them come even though they might not be vaccinated, to ensure consistency across your different centres?
I think that is something we would have to look at, what strategies we use there. There's always going to have to be a certain individual flexibility there. My understanding is that our providers, that their position would be that they would want all children in their centres to be vaccinated or to be on a catch-up schedule as described. So I think from my understanding, it's unlikely that they would actually enrol a child where the parent says we are not going to get the child vaccinated. because the preference of our providers is that all children are vaccinated, unless they have the medical contraindications and so forth. So the position of our providers, as I'm advised, is that they would want all the children in the centre vaccinated. But noting that other centres may not choose to do that, so parents will actually have a choice to go to other centres, not necessarily the Catholic ones.
Thank you very much. Deputy Chair.
I just had a follow-up question that I asked the QNU and Queensland Health. Do you have a policy at all within the Catholic Education Commission about vaccinations of your childcare staff to prevent spreading of disease from staff to child and vice versa?
I suppose I don't know the answer to that, but I can find that out. So I don't know the answer.
Thank you.
Thank you. Member Greenflakes.
Yeah, thank you very much for your submission. In the submission, you note that the child's vaccination history is already part of your organisation's enrolment processes. Do you anticipate any further administrative burdens if this bill passes?
I haven't been advised that people anticipate there to be anything that is significant.
Thank you.
Member for Sarangara.
Yeah, sure. Could you please comment, Dr. Perry, thank you, on how your organisation would operationalise the vaccination provisions if the bill is passed, with a particular focus on the use of discretionary powers in relation to the enrolment or attendance of unvaccinated children?
Mr Haver, I probably can't speak to the detail. I mean, already the processes require an enrolment for there to be a declaration around the vaccination schedule, and I would anticipate that would continue. As I have indicated, I've been advised that our centres would be expecting every child to be vaccinated or to be on a catch-up schedule. So there would be the discussion at an enrolment. My understanding is that would be the expectation, that all children are vaccinated. So if people choose not to vaccinate their child, that they wouldn't meet the criteria for enrolment at the childcare centre, unless there are the special circumstances that we've spoken about.
Thank you very much.
Dr. Perry, do you anticipate, or have you received feedback from any of your centres or people you've spoken to, being concerned or anticipating that there could be some kind of conflict or concern about having to tell parents that our policy is that your child will not be admitted?
My understanding is that has been the practice now, and so they're not anticipating great concern. But the feedback we received, which was very supportive of the fact that they will be protected from being described as discriminatory, suggests to me that has been an issue where, if that's been indicated that you really need to have your child vaccinated, that there could be those who make accusations that you are being discriminatory in your practice. So if this bill provides support to ensure that they are quite clearly protected from being called to be discriminatory, that will be a very positive thing.
So essentially you're saying this bill gives the protection really for Catholic education to continue with the policy they already had in place.
That's correct.
Hence how it's worked.
Yes.
Very well.
And so that's why there's been very positive feedback from our providers around this bill.
Great, thank you. I think you have also survived unscathed. Your first appearance before the committee. We thank you very much for your appearance.
Hopefully helps you catch up some time. So
Thank you.
Thank you.